Hello, 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 everybody. Ugh. Welcome, welcome, welcome. I'm sorry, there's all kinds of technical issues tonight. Um, tonight, our friend Mark Miller is not able to go tonight. So I gave a talk recently to the Kidney Solutions group about PKD, and I thought that I would come on tonight and talk to all of you about that. And I'm sorry for the technical glitches and the problems and all that kind of stuff. And I'm hoping that everybody can hear me, and hopefully there'll be a replay and we can talk a little bit then. So, at any rate, welcome to Kidney Stories with Uncle Jim. And I guess I'm the guest tonight. So, let's talk a little bit about PKD. First, a little bit about my experiences with PKD. When I was 25 in 1983, I had chest pains, or what I thought were chest pains, and I went to the hospital. And as it turned out, they did a simple X-ray, and my family doctor, Dr. Black, who was then from Portage, came and talked to me and said, "You know, your kidneys are full of cysts, both your kidneys." And he referred me down to IU Health in Indianapolis, and down there, they put me on high blood pressure medication. They drew my blood. They tested my urine. They put me on a kidney diet right away. So, I began to realize this was some serious stuff. Eventually, 4 years later, I ended up on dialysis. Uh, or I should say, at the age of 58, I ended up on dialysis, not 4 years later, and I was on dialysis for 4 years. When I was 62, I had a kidney transplant. April 27th of this year, that was in 2016. April 27th of this year, I will be celebrating my seventh kidney anniversary. I've lost 5 members of my family to PKD: 2 aunts, an uncle, my dad, and my cousin Rich. We'll talk about Rich a little bit later. So this is a serious thing. I have it, and I'm the first one in my family to be transplanted, and I want everybody to know that I'm very grateful. So I am a 40-year plus PKD patient, diagnosed at 25, dialysis 58, transplanted in 2016 at the age of 62. I'm 68 now. So, and as I said, I lost 5 members of my family to PKD: 2 aunts, an uncle, a cousin, and my dad. So let's talk a little bit tonight about the things that we're going to cover. So we're going to talk about what is PKD, what are the symptoms, what are the causes, what are some of the complications, what steps, if any, we can take to prevent it, how we're diagnosed, what treatment is available, and then what's new in PKD land. So to start off, what is polycystic kidney disease, or abbreviated PKD? It is an inherited disease that develops into clusters of fluid-filled cysts that damage good kidney tissue, and over a period of time, they enlarge and take up good kidney tissue and basically destroy it. And as a result, you begin to lose function over a long period of time, and eventually it causes your kidneys to fail. Now, most people, their kidneys fail around their 60s, like mine did. So it's a slow developing process. It's found more frequently in Afro Americans. Uh, of course, it's related to genetics, and uh, the problem is there is not equality and opportunities for treatment. And the PKD Foundation and the PKD advocacy champions that I work with, we stand for equality in treatment. As a matter of fact, I'm going to Washington, D.C. starting on the 21st of this month. We're going to be evaluating proposals for grants for scientists that want to cure PKD, make some medication that's a little better than Talvaptan. In some way, make things better for PKD patients. So passing the gene that causes PKD, generally speaking, it's a mutated gene that causes polycystic kidney disease, and it is passed from the affected parent to child. However, word of caution, however, every once in a while, it crops up spontaneously and without explanation. So if you begin to have the symptoms that we're going to talk about a little bit later, don't wait around. Get yourself in to see your doctor, and if he doesn't satisfy you, then go see a nephrologist and get to the bottom of it quickly. You don't want to mess around with this. The sooner it's treated, diagnosed, and taken care of, the better. So if one parent has the mutated gene, the child has a 50-50 chance of inheriting it. Normally, if both parents have it, there's a 100% chance that the child is going to inherit it, particularly with ADPKD, and we'll talk about that in a minute. There is such a thing as inactive carriers. In other words, you can inherit the gene, and for some reason or other, it doesn't activate, but you can pass it along to somebody else. So that's another little trick to this disease that makes things a little bit risky. So if you have it in your family, please go get tested. Just because you don't have symptoms or you don't have problems, as a matter of child planning, you may want to check that out. It's better to know than to not know. The disease can cause serious complications like high blood pressure and kidney failure. It varies in severity, but some complications are preventable, and if not preventable, they can be manageable. Lifestyle changes and treatments can reduce the damage to your kidneys from complication, high blood pressure medication, kidney diet, perhaps being placed on Talvaptan, for example. So what are the symptoms of PKD? What should we be looking for in terms of, what happens with PKD? Symptoms include, and by the way, I've had most of these. High blood pressure. As I said, when I first started out, that was one of the first things that they did for me down at IU Health. Dr. Hellman was my doctor at that time. They put me on what was called Hyzar, high blood pressure medication. You may have back and side pain. That can be pretty intense. You might get a fullness feeling in your abdomen. The size of your abdomen may increase. The size of your normal kidney is about the size of a fist. The size of a PKD kidney is about the size of a football. So you might see that there. Headaches, very common problem. Kidney stones. Boy, when I was in my 40s, I was passing kidney stones at least once a month, sometimes multiple times a week. So that was a big heads up for me. It can result in kidney failure, as I said. The cysts take up the good tissue in your kidney, and it's a slow developing process, but it can cause your kidneys to fail. Urinary tract infection, very, 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 very common with this disease. So what is the cause? It is an abnormal mutated gene. And what I see that the scientists are looking for in the things that I read, they're looking for the pathway that causes this. In other words, the theory is you start out with a normal gene, and somehow as you progress through your development with your kidneys, there's a pathway that causes your normal gene to become abnormal and mutated, and that is what causes the disease. So what types of PKD are there? All right, so there's two types, basic types. My B phone's out of whack tonight too, so I'm using my notes. The first type is called autosomal dominant polycystic kidney disease, ADPKD for short. Autosomal dominant means you can get the PKD gene mutation or defect. You only need one parent for that. Researchers have found that there are two different kinds of gene mutations that cause ADPKD. One is called PKD1 gene. 1 out of 6 or 1 out of 7 people have ADPKD as a result of PKD1. Or there's also what is known as a PKD2. 1 out of 6 people get it from that particular variety. Most defects that occur are out of PKD1. ADPKD of the two is the more common type, and it affects more than 600,000 Americans and 12.4 million people worldwide. Signs and symptoms of ADPKD often do not develop until your 30s or your 40s. You think about me, 25, when I was diagnosed, relatively close. This version in the past was called the adult version of PKD because of the slow development and showing up when you're 30. However, if you'll recall from our broadcast with Dr. Christian Hanna, it's been found recently that children can develop this disorder much earlier than in your 30s. It could be as early as birth. And if you recall, Dr. Hanna also told us the way that this is discovered in most children is by accident. They have an ultrasound, an X-ray, a CAT scan for some other reason, and you discover lumpy kidneys. Polycystic kidney disease, the ADPKD kidney. This is the form of PKD that accounts for most cases. Now, in my family's case, everybody but my cousin Rich had ADPKD, the more common version. My cousin Rich had what's called the autosomal recessive PKD disease. So that is abbreviated ARPKD. So this version of PKD is a less common version. It's a rare form of the disease. It occurs in 1 of 25,000 children worldwide. The signs and symptoms often appear right after birth, and sometimes they don't appear till later in childhood or adolescence. As you may have guessed, this was originally called the child form of PKD. That's not an accurate scientific term for it anymore, and I'll explain why in a minute. The key here is that both parents must have the abnormal gene to pass this form of the disease. And if the parents carry the mutated gene, each child has a 25% chance of getting the disease. The sad part about ARPKD is it can cause death in the first month of life, although that's not quite the case that it used to be. Almost 80% of ARPKD children survive this newborn period. In the past, 1/3 would need a transplant or dialysis in the first 10 years. However, at this point in time, there's no need to be pessimistic. It is possible that you can have this later in life and that you can avoid dialysis or you can avoid transplant for some period of time. The prognosis for ARPKD has changed dramatically. It is no longer considered a fatal condition. 20 years ago, only half the children born with the disease survived to their 10th birthday. Now, more than 90% of the children survive their newborn period and reach their 20th birthday, and 50% of those survivors do not require dialysis or treatment. Now, about my cousin Rich. My cousin Rich had the recessive version, the ARPKD. He's the only one in my family that had the recessive version. He lived to be around 30. He passed away in his 30s. He found a very nice woman, Dolores. They were married. He had a job. He was doing well. This kind of was found late, and unfortunately, he did not survive it. So let's talk about complications for a minute. Complications include high blood pressure. Elevated blood pressure is very, very common in PKD. Untreated, it can cause damage to your kidneys. It increases the risk of heart disease and stroke. So if you are diagnosed with PKD, you want to check whether or not you have high blood pressure. If you have high blood pressure, you're going to need to take medication. That's probably going to be an everyday thing, but it's better than risking your heart or risking a stroke or damaging your kidneys. Loss of kidney function. Slow, progressive loss of kidney function occurs in nearly half of the PKD patients. As I said, they have kidney failure by the time they were 60. If I look back, not only me, but my dad before me was diagnosed in his 50s, and he didn't live to be 68, 69. So that'll give you some idea. This was back in 1983. I was diagnosed the same year that he passed. So kind of shook your Uncle Jim up a little bit. It can cause uremia, where the waste builds up to a toxic level. You're not passing it. Your kidneys aren't cleaning it. Not a good thing. You can die from that. Progresses to the point where patients will need dialysis or a kidney transplant. My hand's up. How about yours? I did both, dialysis for 4 years, and as I said, I'm going on year number 7 for my kidney transplant. Chronic pain. This is something that occurs primarily to the back or the side, also from urinary tract infections. You can have kidney stones or malignancies. I've had incredible back pain and side pain in my life. When I went to Washington, D.C. recently, I was having pain in that area of my back where the remaining PKD kidney is in my body. I've had a little pain today. I don't know if it's psychosomatic or not, but I have had. I can say with some confidence I've had urinary tract infections. I've passed kidney stones. Yeah, my friends at Second Chance. Hey, how you guys doing today? I've had urinary tract infection, kidney stones. About the only thing that I haven't had that's on this list is kidney cancer, thank God. Now, I've had a number of friends that have kidney cancer, and I will be advocating for Kidney Can. That's a group that people that have kidney cancer. Next week, that's virtual, so at least I won't have to go to DC for that one. So I'll be visiting with my rep in the House and my 2 senators and a few other folks. So, growth of cysts on the liver. I also have cysts on my liver. Now, this is something you have to watch, because when you have cysts on your liver, it can either go one way or the other. It can you just grow a few cysts and it stops, or it proliferates. So if you have this, you have to be checked. The likelihood of liver cysts increases with age. I'm 68 now, got me a little worried. Larger liver cysts in women than in men. Development of aneurysm in the brain. My dad had this, for example. This is like a balloon-like bulge in the blood vessel that can cause bleeding or hemorrhage. People with PKD are at a higher risk for aneurysms, especially those with a family history. People like me, I just had a scan of my head to check for aneurysm. It came back negative, but you have to keep an eye on it. Pregnancy complications. Women with PKD can still have babies, but they have a higher incidence of preeclampsia. Women, have the higher risk to have high blood pressure or declining kidney function before pregnancy. It doesn't mean you can't have babies, but boy, they will check you closely once they discover you're pregnant, and you probably should get checked closely before you're pregnant as part of family planning. Heart valve abnormalities. 1 in 4 adult PKD patients develop mitral valve prolapse, where the heart valve doesn't close properly, allowing the blood to leak backwards into the heart. Not a good thing. When my father died, he died of congestive heart failure secondary to PKD. So this disease does check your heart. That's why every month I go in, they take my blood, they take my urine, they run tests on it. You want to make sure that, everything is A-OK, that your heart is okay, your transplanted kidney, if you have it, is okay. So, I recommend frequent testing. Your doctor is probably recommending that too. Colon problems. How many of you have PKD and diverticulitis? My hand's up. Diverticulitis is a weakness in the pouches of the wall of the colon. It may develop in PKD patient. It causes pain. It's going to cause problems with you passing waste product. So, every once in a while, they take pretty pictures of my intestines. They stick something down my throat. They take pretty pictures of my stomach and my ulcers. Sometimes they do it at the same time. I'm not conscious when they do that, thank God. Prevention. So what kinds of things can we do with preventions? Well, consult the genetic counselor to help assess the risk of your passing the disease on to your offspring. Maintain your blood pressure. Take your blood pressure medications. You want to go on a low protein, low salt diet. You want to maintain a healthy weight. Do not smoke. Do not smoke. Regular exercise, they're recommending 30 minutes a day, and limit alcohol use. That one I can tell you. The last time I drank any alcohol was about 10 years ago, and I believe because of the cyst in my liver, it made me very sick. And this was a Christmas drink, and I really didn't feel like myself again until about Valentine's Day, just to give you some idea. So the alcohol thing, not a good idea for PKD patients. So how are we diagnosed? How do they discover whether or not you have PKD? Ultrasound. This is a non-invasive test. They put a little jelly in your kidney area. They have a device, a wand that they wave over your kidney area. I had this done recently in December. My transplanted kidney is good. My PKD kidney is still a PKD kidney. Not a big surprise there. They also did a CAT scan when I was there. This is a very common way to get diagnosed. They put you in the tube. The electronic thing goes through the tube. They can visualize it a little better. Or they do an MRI. Sometimes with contrast, sometimes not. Most of us that have PKD, they don't like the contrast. That could make your kidneys worse. And if you had a transplant, that could affect your transplanted kidneys. So generally speaking, no contrast. Treatments. What kind of treatments are available? Well, first of all, for cyst growth, there's medication. We're talking about Talvaptan, Jarnique, Semca. This is for sharply progressing cyst growth. This is a pill that you take by mouth to slow down the growth of the cysts. The key to this is There are side effects to tolvaptan. You'll pee more during the day. You'll pee more at night. But the big times side effect is damage to your liver. Therefore, they will monitor you very, very closely. You will go in as frequently as once a week for them to check to see if it's affected your liver or you've had any of these other side effects that cause problems. So constant monitoring for side effects and complications come with that medication. High blood pressure. They combine a low sodium, low fat, low protein diet and calorie content with not smoking, increasing exercise, reducing stress, and medication for your high blood pressure to work with that. For example, when I was originally diagnosed, I was a trial lawyer. So a lot of pressure comes with that job. So high blood pressure medication, kidney diet, low salt, low protein, low fat. Check me every month. I drive down to Indianapolis, pee in a bottle. They draw blood, take my blood pressure, ask me how I'm doing, that kind of stuff. That probably saved my life. And it made my dialysis much easier. It made my ability to get a transplant much easier. So hats off to my family physician, Dr. Black, who referred me, and Dr. Hellman, who took care of me. Currently with my kidney transplant, Dr. Debbie is looking after me. Great job down at IU Health. I highly recommend it. I have a local nephrologist here too, in case things go wrong. You don't want to be put in a position where you only have one guy, one doctor that's looking after you. They did that with my dad, and they threatened him, and they told him, if you go to somebody else, we'll drop you, and we're the only show in Northwest Indiana, and blah 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 blah. And don't let yourself be put in that position. Make sure you have options. Make sure you have good medical care. Make sure you can get a second opinion if you need it. This conflict between physicians, it shouldn't be that way. It should be two colleagues that are willing to converse with each other. So just a little heads up from your Uncle Jim there. Medications called ACE inhibitors, or angiotensin-2 receptor blockers, or ARBs, are often used to control high blood pressure. So if your doctor recommends a medication like that, be sure you take it. Take it religiously. Pain, very, very important here. Recommended dosage of Tylenol. Do not take anything that has ibuprofen in it, like Advil. That's bad for your kidneys. It's bad for your polycystic kidney. It's bad for your transplanted kidney. Not a good idea, my friends. So, and when I say recommended dosage, your normal 500 milligrams of Tylenol. I believe it's not more than 5 pills a day for pain. 5 Tylenol don't take care of it. Go to the hospital. Because too much Tylenol likewise damages your liver, and you don't want that. Sometimes, if the cysts get to be large, and depending on their location, doctors will aspirate the cyst. They'll take a needle, draw out cyst fluid. They'll inject a medication, a sclerosing agent, as we mentioned earlier. If the PKD kidneys get to be too large, they may remove them. And you're definitely on dialysis once those are out. So bladder or kidney infections, antibiotics are used for that. If your doctor describes antibiotics or prescribes antibiotics for you, please take them as directed. Blood in the urine. Not real optimistic solution here. Drink more fluids or wait till it stops. And I can't tell you when I was younger how many times I had blood in my urine. And I'd call the doctor, and that's what he'd tell me. And then he'd say to come in. And of course, there were scans and studies and peeing in a bottle and taking blood. And those came up the same way. You got PKD, Uncle Joe. So, aneurysm, periodic screening, just like I did in December, if found, and depending on the location. Now, sometimes an aneurysm, because of its size or its location, they can't operate on it. They can't do anything with it. They may have to give you medication to try and shrink it. Otherwise, they do a surgical clipping to reduce the bleeding depending on its size and location. They want to control your high blood pressure or high cholesterol. They'll check your cholesterol, and they will definitely urge you to quit smoking. So, okay. I had to use my written notes tonight because my B phone is not working. I don't know what's going on with that, but it's not working. So I hope that that gives you kind of a thumbnail sketch of what's going on with PKD and what you can expect. I'm going to put in a plug now for my good friends at Kidney Solutions. If you have questions about your kidneys or kidney transplants, call up my good friend Kent Bressler at 830-285-2140, or you can write them info@kidneysolutions.org. Please subscribe, share, and comment on the broadcast on the YouTube channel. Also, the broadcast is pinned to the top of my personal page. In that pinned notice of the broadcast, there are several references in the comments to things about PKD and PKD sites and from the PKD Foundation and videos. And you know your Uncle Jim, he does his homework. So if you want to check that out, it's in that pinned notice of the broadcast on my personal Facebook page. I thank you for watching. I'm sorry we started late. I'm sorry about all the technical issues. I don't know what's going on tonight, but we did have some. I will post in the comments to the broadcast replay the things that are coming up. We've had a few changes and added a few guests, so we want to do that. So I'm going to wish you well and good night, and I'm going to hope all my overlays work. So